Putting your child on ADHD medication can feel like a huge decision, and it's rarely as simple as yes or no. Before a child ever starts medication, there are a handful of things I make sure every parent understands first. Not because medication is bad, but because when these pieces are missing, medication often is less effective, causes more side effects, or creates problems that didn't need to happen in the first place. Welcome back. If you're new here, I'm Dr. Dan Sullivan. I'm a licensed naturopathic medical doctor, a certified functional medicine practitioner, and I also have ADHD myself. On this channel, my aim is to educate and empower using evidence-based medicine and a root cause lens, looking beyond medication alone to understand what's really driving ADHD symptoms. Before we jump in, a quick but important note. This video is for educational purposes only, and it's not medical advice. Please don't start, stop, or change any medication for your child without talking with your child's prescribing clinician. Every child is different, every family situation is different, and ADHD treatment should always be individualized. Now, with that being said, let's jump in. When a child is diagnosed with ADHD, most families are offered a fairly limited set of options. Typically, that includes medication, most often stimulant medications, and some form of behavioral or school-based support. That might look like therapy, behavior strategies, or accommodations at school, such as a 504 plan or an IEP. And I want to be very clear, many of these interventions can be incredibly helpful. For some children, they're essential. Medication, behavioral support, and school accommodations all have an important place in ADHD care, and I'm not here to dismiss any of them. What's often missing from that initial conversation, though, is a discussion about the child's underlying biology and physiology, the factors that strongly influence how an ADHD brain functions day to day, and how well medication is tolerated. Things like sleep quality, nutrition, blood sugar regulation, micronutrient status, gut health, circadian rhythm, stress physiology, and overall nervous system regulation are rarely addressed up front. Yet these are the pieces I see make a meaningful difference every single day in my patients. When they're overlooked, medication often works inconsistently, side effects are more pronounced, and families are left feeling confused or uneasy even when they're doing everything they were told to do. That's why before I ever think about medication or alongside it, I always make sure these foundations are addressed. The first core principle I want parents to understand is that ADHD medication works best when the entire system is regulated. Medication can absolutely improve focus and attention, but it can't override a body that's chronically stressed, sleep deprived, inflamed, or metabolically unstable. All of those factors directly affect how the ADHD brain functions and how well medication is tolerated. When those foundations are off, medication often works inconsistently. Side effects tend to be more pronounced, things like irritability, emotional flattening, anxiety, appetite suppression, or sleep disruption. In most cases, that doesn't mean the medication is wrong, it means the system underneath it isn't stable yet. When the system is regulated, when sleep is protected, blood sugar is stable, stress is lower, and the brain has the nutrients it needs, medication tends to work more smoothly, often at lower doses with fewer trade-offs. Focus improves without the same degree of side effects, and the child feels more like themselves. That's why I don't see these foundational supports as alternatives to medication. I see them as the infrastructure that allows medication to work the way it's intended to. The next piece I always address is testing. Most children with ADHD have never had meaningful lab work done, especially in conventional medical settings. And if labs are ordered at all, they're usually very basic, designed to rule out disease, not to understand what the brain actually needs in order to function well. In a functional medicine approach, we look at ADHD through a much different lens. Instead of asking only what diagnosis fits, we ask why the brain may be struggling. That means evaluating biological factors that directly influence focus, mood, sleep, emotional regulation, and overall brain function. Some of the most commonly overlooked labs I assess include iron and ferritin, omega-3 status, zinc and copper balance, vitamin D, red blood cell magnesium, and in some cases, heavy metals. These markers play a direct role in neurotransmitter function, nervous system signaling, and brain energy. When they're off, focus and emotional regulation are harder, regardless of what else you're doing. I've actually done an entire video breaking down some of the most important ADHD related labs, including iron and ferritin, omega-3s, and zinc and copper, and I'll link to that below if you want a deeper explanation of why these markers matter and how they're typically evaluated in ADHD. It's also important to understand how lab results are viewed in this context. Normal reference ranges are based on population averages, not on optimal brain function. A lab value can fall within the normal range and still be suboptimal for a child with ADHD. That distinction often gets missed. The amount and depth of testing I typically order often goes far beyond what's done in conventional pediatric care. And it's not about over-testing, it's about gathering enough information to reduce guesswork, minimize trial and error, and truly individualize care. This is also where gut health comes in. The gut and brain are closely connected, and issues like inflammation, dysbiosis, or impaired digestion can directly affect attention, mood, and behavior. In many cases, comprehensive stool testing provides information that blood work alone simply can't. I've also done a separate video on how gut health relates to ADHD, and I'll link to that below if you want to explore that connection further. The goal of testing isn't to pathologize your child, it's to identify and remove biological obstacles that make ADHD symptoms harder to manage and medication harder to tolerate. The next foundational piece I focus on is what's happening in the morning, because how the day starts has a huge impact on focus, mood, and emotional regulation in ADHD. Many kids with ADHD begin the day already at a disadvantage. They skip breakfast, eat mostly sugar or refined carbohydrates, or rush out the door in a high-stress, chaotic environment. That combination sets off blood sugar swings and stress hormone spikes early in the day, which makes it much harder for the brain to focus, regulate emotions, and stay calm even before school really begins. From a brain chemistry perspective, the ADHD brain is already more sensitive to fluctuations in dopamine and stress hormones. When blood sugar is unstable, cortisol rises and attention becomes more fragile. This is why mornings that lack structure and nourishment often lead to worse behavior reports, emotional meltdowns, or bad days that seem to come out of nowhere. One of the simplest but most powerful changes is front-loading protein at breakfast. Eating within an hour of waking and prioritizing protein helps to stabilize blood sugar, supports neurotransmitter production, and improves sustained attention. Minimizing added sugars and artificial dyes in the morning also reduces unnecessary nervous system activation. Equally important is the rhythm of the morning itself. Predictable routines, gentle movement, and exposure to natural light help regulate the stress response and the circadian rhythm. When mornings are calmer and more structured, the brain starts the day in a more regulated state, which improves focus, behavior, and resilience throughout the entire day. This also matters if a child is on medication. Stable blood sugar and adequate protein can improve how medication is tolerated and reduce side effects like irritability, crashes, or appetite suppression later on. Morning physiology doesn't just influence ADHD symptoms, it influences how well every other intervention works. The next point is sleep. Sleep is one of the most powerful and most underestimated drivers of ADHD symptoms. The ADHD brain is especially sensitive to sleep disruption, and when sleep is off, attention, emotional regulation, and impulse control all take a hit. Many families don't realize how strongly sleep affects ADHD. A child who isn't sleeping well will often appear more inattentive, more impulsive, more emotionally reactive, and more irritable. In those situations, it can look like ADHD symptoms are worsening when in reality the brain is simply exhausted. No amount of behavioral support can fully compensate for chronic sleep deprivation. This is also important to keep in mind when medication is part of the picture. Certain medications, especially stimulants, can make it harder to fall asleep at night in some children. They can also affect appetite and meal timing, which indirectly influences sleep quality as well. These effects don't mean medication is wrong, but they do mean sleep needs to be actively protected. That's why sleep should always be part of the ongoing conversation with your child's provider. Sometimes adjusting the timing of medication, the duration, or the overall approach can make a meaningful difference in preserving sleep while still supporting focus during the day. Protecting sleep means prioritizing consistent bedtimes and wake times, a dark and cool sleep environment, and minimizing evening stimulation, especially screens. When sleep is supported, I often see improvements in focus, mood, and emotional regulation even before any other changes are made. Sleep isn't just helpful, it's a core part of ADHD treatment. Another critical piece that often gets overlooked is structure and skill building. Medication can support focus, but it doesn't teach executive function. It doesn't teach organization, time management, emotional regulation, or how to break tasks down. And those are often the areas where kids with ADHD struggle the most. ADHD brains rely heavily on external structure. Predictable routines, clear expectations, and simple systems reduce the amount of mental energy a child has to use just to get through the day. When structure is missing, the brain has to rely on willpower, and willpower is not a reliable strategy for ADHD. This is true at home and at school. Simple routines in the morning and evening, like visual schedules, checklists, and consistent expectations, can dramatically lower stress and improve follow-through. In the classroom, appropriate supports help to reduce cognitive overload so a child can actually use their attention more effectively. This is why medication alone is rarely enough. Without structure, kids may appear more focused but still struggle to apply that focus in a meaningful way. When structure and skills are in place, medication, if used, tends to work better and more consistently. I often remind families that structure isn't about being rigid or controlling. It's about creating an environment that supports how the ADHD brain actually works. Structure beats willpower every time. If medication is part of your child's treatment plan, personalization really matters. ADHD medication isn't a one-size-fits-all, and how it's being prescribed can make a huge difference in both benefits and side effects. Things like when the medication is taken, how long it lasts, and which parts of the day it's meant to cover are often more important than simply increasing the dose. The goal is to support focus during school and homework while still protecting sleep, appetite, and overall well-being. If a medication lasts too long or is taken too late in the day, it can interfere with falling asleep at night. If appetite is suppressed earlier in the day, kids may not eat enough until later, which can affect blood sugar, mood, and sleep as well. These patterns don't mean medication is wrong, they mean the plan may need adjusting. This is why ongoing communication with your child's provider is so important. Small changes in timing, duration, or overall approach can sometimes make a big difference in how a child feels and functions. Medication should support your child, not override their biology. When it's individualized and combined with the foundations we've talked about, like sleep, nutrition, structure, and biological support, it tends to work more smoothly and sustainably. So I want to leave you with this. The goal of ADHD treatment is not perfection. The real goal is a regulated system, better learning capacity, and a child who feels more like themselves, more capable, more confident, and less overwhelmed by their own brain. Medication can absolutely be a part of that plan. For many children, it can be incredibly helpful, but it works best when it's used thoughtfully as part of a broader, whole child approach, not as the only intervention. If you're a parent trying to make these decisions, my hope is that this video gives you more clarity and confidence. There is no single right path. There's only the path that makes the most sense for your child, your family, and your situation, and that path can change over time. If you found this helpful, consider subscribing for more evidence-based root cause ADHD education. And if you'd like support taking a more individualized approach for your child, you can check out the link below to set up a discovery call.